I'm delighted to be here. Thank you so much for having me. And I'm thrilled, even though it's Monday morning, to be talking about COVID policies and Medicaid. So we will go ahead and jump right in. The plan for today is to really just do a quick overview, then to dive into some of the details. I heard a rumor that you guys got a sneak preview of this if you heard our Medicaid director, Jim Jones, talking last week about some of this stuff. So I think everybody is generally familiar with these things, but maybe not the details. We're going to have some discussion about policy end dates. And then I'm going to touch briefly on food share policies that are currently in effect, and then wrap up with a rousing slide about income counting rules. So that is my plan. And Shannon is going to help me field questions as we go through. I'm happy to take questions as we go, because I think that's sort of the best way to do this. But I'm also going to try not to hog the entire session time. So if it seems like we're going to be here until noon, based on questions we're getting, I might move us along. So that is the plan. Okay. So I'm not going to get into a huge amount of detail about why we're doing and making any of these Medicaid policy changes for COVID. I think most of it is fairly obvious, but did want to just say that, first and foremost, these policy changes are intended to help protect the safety and well-being of Wisconsin residents and help people maintain their healthcare coverage during the pandemic. That's the number one thing. But we also have had to take into consideration our state and federal authority to make changes. So that's one boundary that we've been working with. And then I also think it's important for everybody to know that the Families First Coronavirus Response Act, which I think people say abbreviate as FCRA, put into place some enhanced Medicaid funding for states, but it put some conditions on that enhanced funding. So some of the things that we're going to talk about, you might feel like, why are you doing it that, or why are you doing it that way? And I will refer back to FCRA as the reason that we're doing it that way. So just kind of wanted to give a sense that there are some things, some external forces on how and why we made the changes that we made. So just at a snapshot level, we have continuation of coverage for people in Badger Care Plus and Medicaid. We have also postponed Badger Care Plus and Medicaid renewals. We have a policy called Best Available Information. We have suspended premiums. We've suspended the treatment needs question for childless adults. We have temporarily exempted people in the Medicaid Purchase Program, or MAP, from work requirements in that program. And we have expanded our presumptive eligibility determinations to the elderly, blind, and disabled population. So those are I think there's 7 bullet points there. Those are the 7 policies I'm going to talk about today. I think that brings us to our first polling question. So just to make sure everybody's awake at 9:08 on a Monday. Mike, do you want to pop those up?
Yeah, great. So we'll give everybody just a few seconds. Maybe we'll go to 30 seconds and then we'll move along. Terrific. And Mike will display the results shortly and we can move ahead, Autumn.
Okay, great. Awesome. Okay, so let's jump right in. The first and probably the most complicated policy change is continuation of benefits. Oh, good. And so, Mike, I think everybody can see this, but it looks like, the majority are aware of most or a few, and then small bars on either side are aware of all of them or none of them. I did just hear from somebody that they're having trouble hearing me. Is that an issue? Because I can scooch right up to my computer and you're going to get way more of my face than you want, but that's about as close as I can get. Is that better?
Autumn, we can hear you fine. Sometimes
Okay.
people have specific issues, but you're coming through loud and clear for me.
Okay. All right. Well, if that stops, feel free to interrupt me and let me know. Okay. And maybe I'll back away from the computer. Okay. So we are talking about continuation of benefits. And I think I was saying this is one of the more complex, or there's more to this than some of the policy changes. The normal policy, not to state the obvious, is that in order to continue to be enrolled in Medicaid or Badger Care Plus, you have to keep meeting the rules for the program. Under COVID-19 policies, and again, this is related to the requirements in FCRA, anyone who is enrolled on or after March 18th is going to stay enrolled at least through the month in which the federal public health emergency ends. So I'll turn the page here and get into some of the details. There are some exceptions. If someone moves out of state, we will end their coverage. If they request to disenroll, we will end their coverage. If they pass away, we will end their coverage. And then we do have, there is a possibility that someone might move between benefit plans, but the restriction we've put in is that they can move from a lesser benefit plan to a better benefit plan, but not the other way around. So I think the best example I can give here is with family planning only services. If you had someone who was enrolled in family planning only, they would maintain that coverage. If their circumstances changed and they became eligible for Badger Care Plus, which is a full benefit plan, we would move them to Badger Care Plus. But we would not do that in reverse. We would not have someone who was in Badger Care Plus, income went up. Normally, they could only get family planning only. Under the COVID policy, we're going to keep them in Badger Care Plus. So those moves from program to program should be significantly less than they normally are. And like I said, we would improve someone's healthcare coverage, but not reduce it. I also want to point out that for our purposes, this policy includes people who were eligible for backdated coverage but not ongoing benefits. Basically, in order to trigger the continuation, you need to have been eligible after March 18th for at least 1 month. So if you had someone who came in, I'm going to try to ad-lib this, which will probably go poorly, but if you had someone who came in October and applied in October and asked for backdated coverage in July, August, and September, even if they're not eligible in any month except July, we would still consider them to be enrolled in the program, and that would trigger this continuation of benefits. I also want to talk about, it's not on the slide, but I want to talk about a couple of special populations. The Badger Care Plus prenatal program, which is for immigrants who are pregnant who don't otherwise qualify for Medicaid, and then presumptive eligibility, which is a temporary enrollment process that I'll talk in more detail about in a little bit. So those were not populations that were covered by FCRA. And in the interest of transparency, because of that, we didn't intend to have to continue their coverage. So you may have heard from DHS in one way or another that we were not providing continuation of coverage for those groups. As it turns out, our system was not differentiating between those populations and other populations. So it's kind of a unintended but good outcome, which is that they are also covered by the continuation. So I know that's a little confusing because, you know, again, you may have heard earlier this summer that, nope, we're not continuing them, but in fact we are. So, okay. Then one other point on continuation of benefits is that it extends to that prohibition against ending coverage extends to increases in patient liability or cost share, and that's specific to people who are in long-term care programs. I know that this group at the presentation today may not deal very much with long-term care programs, but I think it's just helpful to know that for those programs, people typically have to pay to be in a contribution to being in a nursing home or pay a contribution toward their in-home care services. And we are not, during the public health emergency, increasing the amounts that someone has to pay. So I'm going to pause there and see if Shannon, if you have seen any questions about the continuation of benefits policy, or if you have anything else to add.
Hi, Autumn. We don't have any questions about the continuation of benefits. We have one question, and that is, does every new enrollee receive a coverage information packet? Is that mailed?
I'm not sure. I mean, we do mail everybody what we call it an ENB. It's like our enrollment and benefits handbook. So we do send that to everybody. We also send them an HMO enrollment packet if they are in a group that would enroll in an HMO. So I think the answer is yes, we do mail, but I'm not sure if the participant is thinking of something different from either of those items.
Sure, thanks. And if the questioner wants to give some more specificity, that would be great. Otherwise, we have a few more questions, but I'm going to let you go through a few more slides before we get to those.
Okay, great. And I'm hearing from people again, it looks, I mean, I'm seeing these little things pop up saying that it's hard to hear, so I'm sorry. I will try to point my face in the right direction and try to speak up. Okay, moving on. The next one is postponed renewals. And as many of you know, the normal policy for renewals is that members need to provide a renewal of their benefits every 12 months. This looks a lot like an application process, although it's streamlined. We're asking people to review the information we have on file rather than provide all new information. It's something that can be done online, by phone, by mail, or in person. And the sort of short answer is that during COVID, we have postponed healthcare renewals. So I'm going to turn in the next page and talk about that in a little detail. So for any given individual, we've been postponing healthcare renewals 3 months at a time. I don't know. I think like all of us, you know, when COVID started, we sort of had this idea that it was going to be over quickly, and so it made sense to just like keep bumping people out by 3 months and 3 months and 3 months. And now we're at a point where, you know, someone who originally had their healthcare renewal scheduled in March has had it bumped to June and then September, and is now scheduled for December. We are not. You know, we're not notifying people of those bumps as they go along. The way that renewals typically work is that or the way they do work is that we send them a letter 45 days before the renewal is due, and we say, okay, your renewal is due in 45 days, please do it. The long and the short of it is that before someone has to complete their next renewal, we will send them a letter 45 days in advance, and we don't know yet when those renewals are going to start up again. One finer point about renewals is that there are some people, about 20% of our population, are able to have an automated renewal done by us using data exchanges to check and verify the information we have on file. We've continued to do those. So in situations where we're able to do what we call an admin renewal and then extend people's eligibility out by 12 months, we're absolutely doing it. But it's only, like I said, about 20% of our population. You know, do we have, for only about 20% of our population, do we have the data exchanges to be able to do that? There have also been a lot of concerns, and we're hearing these from our income maintenance agencies, we're hearing them from providers and HMOs. I mean, everybody's concerned that as we have been postponing these renewals, that it's going to create these huge spikes or bubbles in workload and in demand for renewals once it's all over. So we are actively looking at ways to smooth out those bubbles, and there's a very, very good likelihood, almost guaranteed, that we will be adjusting renewal dates to try to smooth things out and just, you know, not have a situation in which in 1 month there's a tremendous number of renewals due, and then in the next month there's no renewals due. So that's renewals. Moving on, the next policy is what we call best available information. So again, as many of you know, our normal policy is that when someone reports information to us, either through an application or a renewal, or if they're reporting a change in their circumstances, we will first look to see if we can verify it through a data exchange. But if we can't, we typically send what we call a verification checklist and ask the person to provide written verification of some kind, usually pay stubs if we're talking about income, to prove what they've reported. And if they don't verify it, then we will end or deny their benefits. Under COVID, because of, well, for a variety of reasons, you know, we're aware that many employers have been shut down. We're aware that many banks have been shut down, or at least there's been limited access to them. Just for helping to maintain coverage and also to avoid sending people out into the world when they didn't really need to be out in the world, we are accepting most reported information as best available. And that's true for all 4 of our programs that are administered through the income maintenance agencies and through the CARES eligibility system. So that's healthcare, Foodshare, Wisconsin Shares, and Wisconsin Works. As I was looking at these slides last night, I was like, I just want to say very plainly, this basically means that people don't have to verify what they're reporting, that we will take what they've reported and use that in our eligibility determinations. All right, Shannon, I'm going to keep going until you interrupt me, so please interrupt me as needed. Okay, so the next thing is premiums. Under our normal policies, there are 3 groups who pay premiums in order to get coverage through Badger Care Plus or Medicaid. Those are some children, so children with higher income, higher family incomes, some Badger Care Plus childless adults, and then some members who are in our Medicaid purchase plan or MAP. For the public health emergency, premiums are suspended. So it's pretty straightforward. People don't have to pay premiums. Treatment needs question. So this is a policy specific to childless adults in Badger Care. And as many of you know, back at the very beginning of 2020, we were in the process of rolling out some policy changes we were required to make for the childless adult population. And one of them was that we were requiring people to answer a question about their treatment needs or substance use disorder in order to enroll in Badger Care Plus. Since I'm talking about it, I'd always like to say it doesn't matter what they answer, it's just that they had to answer the question as a condition of eligibility. We were in the process of rolling that out or implementing on a rolling basis. So, you know, I believe it was February 1st of 2020, all new applicants were subject to the question for if they were childless adults, and then existing members were being subject to the question at their next renewal. COVID happened and sort of upended all of that. One of the requirements in FCRA was that we were not allowed to impose any more restrictive policies than we had before January 1st. And so we've basically rolled everything back. And the treatment needs question is no longer a condition of eligibility. Folks have pointed out, and this is absolutely true, that we do still ask the question. Fair enough, we do. But it is not required, and it's not, unlike prior to COVID, it's not a condition of eligibility.
Autumn, we do have a few questions.
Sure, let's stop.
And so we'll go ahead and go through those. So one of the questions is, just to verify, if a person is on Badger Care Plus after March and their income goes above 100%, they will not be removed?
That's correct.
Great. And then the second one is getting a little theoretical, but if the public health emergency date is pushed out to January of 2021, is this going to change members' regular renewal dates?
I would say in general, with renewal dates, all bets are off, right? For any given individual, at this point, we've probably changed their renewal date already. And if the public health emergency is extended, I would imagine that we will continue to push renewal dates. So I think I would say that the whole idea of someone having a regular renewal date has pretty much been torpedoed by COVID at this point.
Okay, we've got another one. And this is about premiums. So the question is, are premiums for radiology, for example, CT scans, MRIs, have they been suspended too?
So when I talk about premiums, the language I'm using is I don't know if it's Medicaid specific, but when we say premiums, what we're talking about are monthly payments that people have to make in order to maintain their coverage. If for childless adults, it's an $8 premium, give or take. For children, it starts at $25. MAP, I don't want to venture a guess, also starts at $25. But those are not happening. People do not have to pay those monthly payments. When we're talking about money that people have to pay to get a specific service, those in my parlance are copays. And those were waived for a certain period of time, but those have not been waived or eliminated because of COVID. Does that, Shannon, in your mind, does that answer the question?
Yes. So the difference between a premium copay is important to understand here. And thanks for that clarification, Autumn.
Yep.
We have another set of 2 questions that are related to the best available information. Mm-hmm. So I'm going to try to hopefully get them both answered. So someone is just confirming that what does this mean practically? Does it mean that pay stubs are not required? And if an applicant reports verbally when doing a phone application, is their income accepted without other verification?
So from a practical standpoint, I would say that it's always in the member's best interest for us to have as accurate information as we possibly can, so that we're making a correct eligibility determination based on what their actual income is. So if someone has pay stubs and they've got them readily available and they can, take a picture on their phone and they can, get them to us, that is always a good thing. There's really no reason not to do that, but it's not required. And we are no longer, I think for us, the main change is that we're not pending cases. We're not pending people's eligibility in order to get written verification. When someone reports on the phone, we will say, okay, great, we'll take it. And we don't put a question mark on it. We don't send out the verification checklist. We don't require people to verify.
Thanks. And then the second part of the question regarding best available information is, what is this connected to? Is it connected to the MOE? And I apologize, I don't know what that means. Perhaps you do. Or Medicaid waiver changes. And when might Wisconsin switch back to normal information requirements?
So the MOE is the maintenance of effort requirement in FCRA. And it's, that's the part that says we have to maintain people. The best available information is really not tied to either or any of the federal requirements. It was really a decision we made early on in COVID that said people are going to have trouble getting verification because at that time, most things were shut down. And also, we don't want people to take unnecessary risks in going out to obtain their verification. And so it was really more of a state level decision that said we think it's important to maintain people's coverage. Also, for healthcare, people aren't going to lose eligibility if they don't verify, and so we didn't want to. I mean, I don't want to say that verification is not important, but it's sort of like it's a little bit irrelevant because if they're, even if they didn't, even if an existing member didn't provide verification, they wouldn't lose coverage. So to insist that they provided it seemed a little weird. So anyway, that's a long way to say that it was a state decision. It's not required by any of the feds. If the federal health emergency goes on forever, we might consider changing it. We have the flexibility to change it before the end, the final end, whenever that might be. But for now, we are maintaining it as part of our regular, sort of this package of policies. One thing I wanted to mention, I forgot to say as part of the first question, is that we actually have a ton of data exchanges that we use on the back end to verify people's information. So that helps, in terms of just making sure that we have correct information on file.
Great. Thanks, Autumn. We do have a few more questions, but I'm going to hold them and let you go forward, and then we'll take another pause.
Okay, great. Yep. Maybe we'll get through end dates, and then we can do a whole barrage of questions. How about that? Okay. So moving on, MAP work requirements. I mentioned this earlier. So MAP is a program for individuals who have a disability and who are working. There are some exceptions, but generally speaking, with MAP, there's a work requirement. And so we have temporarily granted exemptions from that work requirement for both applicants and existing MAP members. And then the last but not least policy change is a change in presumptive eligibility. So as this group may or may not know, we have a presumptive eligibility category, which is a temporary enrollment process that it occurs through partners and providers to sign people up for up to 2 months of benefits using a sort of streamlined application process before people move on to getting ongoing benefits by applying through their income maintenance agency. Normally, PE, presumptive eligibility, or PE, is for some children with lower incomes. It's for adults under 65, not receiving Medicare. And under COVID, we've extended those PE determinations to include people who are 65 or older, blind or disabled. So that's the end of the policies. Now we're going to get into policy end dates. So I have some disclaimers. The first is that the end dates I'm sharing today are estimated, and they're based on the current public health emergency, federal public health emergency, expiring as of October 24th. If that emergency is extended, the end dates will most certainly change. But the most important thing, and so we'll talk in a little bit more detail about dates, but the most important thing I want everybody to walk away from this presentation with is that we will notify people in advance if they have to take action to maintain their eligibility or if there's going to be a change in their eligibility. So, you know, and you know, as you, those of you who've worked with the program know that sometimes in advance means 10 days before it happens. We are talking about a longer time frame. So we want to try to get letters out to people at least a month in advance if there's something they need to do or if they're going to experience a change. So I think it's time for my last polling question, my second polling question, Mike.
And I apologize, is that going to be the Sally question or is that the predictions?
It's the prediction.
Okay.
And Autumn, we'll let this one stay up. We'll go to 45 seconds. So if everyone could take a moment to answer the polling question, to look into your crystal ball and make a prediction here. Go ahead, Autumn.
Okay. Oh, good. Here we go. I predicted it will be extended. That's what most people said. And as it turns out, I didn't want to mess up my polling question by saying this before, but as of even just last Friday and early this morning, there's been a flurry of discussion. It seems like the feds are moving in the direction of going ahead and extending. And that extension, which I don't believe it's been formally announced yet, but I think it will be, would be until January 21st of 2021. And there's always a chance that it'll be extended beyond that as well. So we're going to look at dates as if it were ending in October, but again, the strong likelihood is that it will be postponed. But I think as you look at these dates, you know, consider that the basic math will be the same. You know, right now, when we're talking about continuation of benefits, for example, we're saying our projected end date is December 1st, meaning December would be the first month in which anyone would see a termination of benefits. So if we, you know, move ourselves and fast forward to January of 2021, if the PHE, the public health emergency, ends in January, then the sort of equivalent formula would be that the first month of benefits ending would be no earlier than March, if that makes sense. So so I'll run through these. So like I said, the continuation of benefits, the projected end date for those is December 2020. Postponement of renewals at this point, or you know, again, with that October date, the projection is that we would start doing renewals again due in December, which means that letters would go out mid-November. Best available information would end as the public health emergency ends, so that would be a December 1 date. Suspension of premiums and the treatment need question and the exemptions from the MAP work requirement, those would all take effect as of the beginning of the next quarter. So that's why those show here a January 1 date. And then the presumptive eligibility expansion is one where you know, we have the ability to continue that if we want to, and I think there is interest in doing that, although not fully decided yet. So so it's hard to predict if and when that one would end. Okay, so we're going to take that break and do questions.
Great. So we've got some very timely questions here. And the first is just going back to the renewal date changes and how those are communicated to folks. How will they know? What will they receive? What will they see? What will they hear?
So I would say that when somebody is up for renewal, they will get that 45-day letter. They'll get a letter 45 days before their renewal is due. If they want to check ahead and see when their renewal is going to happen, as dates are being postponed, those are being updated in Access, so people can look in Access or My Access to see when their next renewal is due. But again, I really want to emphasize, I know it's hard because I'm saying a lot about like, we don't know when things are going to end up, when renewals are actually going to start and when people are actually going to have renewals. But these things are moving and they're continuing to move. So I don't know how much stock to put in, looking and seeing, oh, okay, my renewal is now in December, and then in a few weeks we're going to push it out. We could potentially push it out again. So I think the 45-day letter is really the key thing in terms of knowing when someone's renewal is actually happening.
Okay. So the next one is a scenario. So we'll go through it. So if a member was under, or if a client was under 100% in October, so 100% of the federal poverty guidelines, but in November and beyond, he is over 100%, 100% being the eligibility for adults in Badger Care Plus. And he applies in November for Badger Care Plus, but with October backdating, so he requests retroactive coverage to October. Will he stay on Badger Care Plus because he was under 100% in October?
I believe so, because we are saying that we are maintaining kind of this continuation of benefits concept until December. So he would be eligible potentially for October and November, but then he would be over the income limit in December.
So he would be eligible for the duration of the public health emergency, right?
Right. But if sorry, if we're assuming that the public health emergency ended in October, I wasn't sure. I'm not sure which dates we're talking about, but
sorry.
Yes, if the public health emergency is extended, and we have that scenario where he applies in November, backdated to October, then he's fine, right? Because then he's sort of covered under the umbrella. But if he's doing all of that, and we're looking at an end date of continuation of benefits of December, then those normal rules would kick in December.
Right.
Sorry if I made that more complicated than it needed to be.
It's okay. It is a bit complicated. And we are getting some questions about the projected dates here. And just to reiterate what Autumn has shared is these were projected policy end dates if the public health emergency was to end on October 24th. It's looking like that will be renewed, though we don't have that definitively in writing. So I would say at this point, folks listening and watching, these dates are not likely to be meaningful dates. Autumn is trying to convey sort of a timeline for when we might have an end date and what that would look like in terms of the amount of time people would have notification. So if the public health emergency ends, it's looking to me, and Autumn, check me on this, like folks will have another month of coverage, and then following that month is when benefits will begin to, and eligibility will begin to return to normal considerations.
Yeah, I think that's absolutely right. I think the main thing to take away here is that if the public health emergency were to end on the 24th of October, we are not turning around and terminating people November 1, right? We have to give people adequate notice before we make any changes to eligibility. And so that's where the December 1 date comes in.
All right, so we've got a more complex policy question here for you, and that's, given the changes the legislature made to DHS authority during the 2018 lame duck session, do you anticipate any difficulty in taking a more measured approach to renewals and unwinding the maintenance of effort requirements?
I know it's annoying when people say that things are above their pay grade, but that is a question that's above my pay grade. I mean, we were able to get through the state authority that we needed in order to make the policy changes that we needed, and we've been smooth sailing. So, yeah, and I believe, don't quote me on this, but I believe that most of the changes we made are tied, in fact, to the public health emergency. So if it's extended, I think we're okay. Period. I think we're okay.
Okay, let's continue, and then we'll take some questions at the conclusion of your session, of your piece, Autumn.
Okay, great. So one thing I wanted to get into just a tiny bit of detail on was the policies for childless adults. You saw on the last slide that I had some big old asterisks there. So as I mentioned, back in early 2020, which feels like about a decade ago, we were implementing childless adult policies on a rolling basis. So new applicants were required to pay premiums and answer the treatment needs question as of February 1st. And then existing members were having those policies implemented as they did their next renewal. Again, the dates are a little fuzzy right now. It's hard to pin them down exactly, but we will be implementing a similar rolling basis implementation once the federal public health emergency ends. So new applicants would be subject first, and then existing childless adults who are in Badger Care Plus would have policies implemented at their next renewal. And there is absolutely interaction here between the next renewal and our postponement of renewals. So, it's possible that someone might have an even greater delay than they normally would in having those policies implemented. Okay. Okay, so now we're going to switch gears. I wanted to talk super briefly about food share policies that are currently in effect. And I'm going to do this with a big disclaimer, which is that I'm a healthcare policy person, and I know just enough about food share to be dangerous. So if you have lots of questions, I probably should not answer them for fear I'll tell you the wrong thing. But because many of you are working with people who are enrolling both in Medicaid, Badger Care Plus, and food share, I think it's helpful to just have some awareness of what on earth is going on. I would further just note that food shares policies are a whole different beast from Medicaid's policies in the sense that they are not necessarily tied to the federal public health emergency. They are administered through the USDA's Food and Nutrition Service. My observation is that FNS, Food and Nutrition Service, has been much more like month by month and requiring us to apply for and get approval on a month-by-month basis. And also they tie things more to the state health emergency than to the federal health emergency. So, much to the chagrin of everyone, food share policies have been a little bit more stop and start. And there are things that we did that have since gone away. I'm not going to talk about those. So anyway, these are the things that are currently still in play. So the first bullet point has to do with what we call emergency allotments. And it's basically that in emergency situations, food share members can get the maximum allotment for their family size. And for some people, that's a huge bump in benefit amount. We did that in March, April, May, July, August, and September. We're also doing it in October. We are applying for it in November. So the hope here is that we will continue to be able to get these larger benefit amounts for people. So just something to be aware of. There are some temporary changes to work registration requirements. Basically, we're trying to be more relaxed about making people register for work and meet some of the finer points of work requirements for food share. We have also suspended the requirement that people who have been convicted of a drug felony need to be tested for drugs. And then the last one is that as part of the pandemic, we introduced online food purchasing through Amazon and Walmart. That is not a pandemic-specific thing. It was sort of inspired by the need to, kind of get going on online purchasing, but that'll continue after the pandemic. Okay, and then to wrap things up on a high note, income counting. Just wanted to put in a quick note here on some of the COVID-related payments that have come through. So the new news here is that there is a program called the Lost Wages Assistance Program. This is a FEMA-funded supplement to unemployment that Wisconsin has applied for. It's an extra $300 a week from the feds for people receiving unemployment compensation. And it has not, to my knowledge, it has not started yet, but we folks are planning for it to start. When it does start, it will likely be retroactive primarily, but it is not going to be counted for Medicaid, Badger Care Plus, or for Food Share. The other 4 lines on this table are things that have, these are policies that are, somewhat longstanding in COVID time, which is that the extra weeks of unemployment, the expansion of unemployment are counted. They're considered to be regular unemployment for purposes of Medicaid and Food Share, unless they're retroactive for Food Share. The FPUC, which is the extra $600 a week that ended in July, is not counted for healthcare programs, but it is counted for Food Share. And then the economic impact payments, the $1,200 tax refund checks that came out a million years ago, those are counted for neither Medicaid nor Food Share. So I'm sorry that I ended on such a mind-numbing note, but let's jump back into questions.
I just want to say this isn't mind-numbing at all. This is part and parcel. This is something that we get tons of questions about. So I think this slide is actually very helpful to this group. So we do have a few questions, and we'll take a few minutes to do some of them, but then we are going to move forward with Tokela's presentation. Yep. So we have one question about pandemic EBT, and is there any information or updates on that program, which is designed to serve families with school-aged children to replace the food and nutrition services that they would receive if they were going to school in person.
Yep. So I can share a little bit of information, although I think, like many things, it's still kind of in flux with PEBT. So one of the requirements from the feds was that we needed to have every single issuance from the 2019-2020 school year wrapped up, resolved, finished by September 30th. And so that was our main focus, was making sure that we were able to get benefits to all of the people who needed to get them for that school year. There was an opportunity to get benefits for August and September, but those also had to be issued by the end of September. And because of the sort of overlap in timing, we were not able to do that, to take advantage of that. However, as many of you probably know, there's a continuing resolution happening at a federal level, and that does provide more PEBT, more funding, and more opportunities to extend that program. And so I think that at this point we're looking, my colleagues are looking at that continuing resolution, thinking about what it would mean, and hopefully we can take advantage of it.
Thanks, Autumn. So our next question is, are all counties following the same rules regarding Medicaid COVID-19 policy changes? And this is specific to, and I'll give the scenario. I know of some that are enrolling that are requiring folks to turn in proof of income before coverage will become active.
So the policies are supposed to be consistent across all counties. And the policy is pretty clear. We're not pending cases before issuing benefits. I will say that there are some eligibility factors that we can't accept best available information. So citizenship, immigration status. There are a few things where pending would be legitimate, would sort of be the right thing to do. But income is not one of them. I will also share that Food Share, because Food Share is a benefit that's like a dollar amount, and it's tied directly to, the dollar amount is tied directly to what someone's income is. That we have been concerned since the beginning that taking best available or self-reported information was going to result in errors in the Food Share calculation. And so we have been asking people via letter to provide verification of their income if they can for Food Share cases. But that again is not our normal practice of pending the case and not starting benefits before we receive verification. So I am dismayed to hear that you are seeing that.
Okay, good. And this will be our last question. If we have time at the very end of the entire session, we'll go back to unanswered questions. But our last question for now, and it's related to MAP. So since the work requirement is suspended for MAP, can individuals apply for MAP without the work requirement? Or,
Yep.
okay, they can. So the follow-up to that was, does the work requirement exemption apply only for individuals currently enrolled in MAP?
No, it's for applicants or members.
Okay, great. Thank you so much, Autumn. Please stay on as we might get to more COVID Medicaid policy questions at the conclusion of our time today. But Tokela, if you could join us now and share your slide deck, that would be wonderful. So just 1 minute, folks. Tokela, if you go up to the top, there's a share and then my screen. Perfect. And then if you just want to put it in presenting mode, we'll be all set. So welcome, Tokela. Tokela is from Milwaukee Health Services, and she is an outreach and enrollment specialist there. And she has been assisting a lot of folks throughout the pandemic with Badger Care Plus as well as Foodshare. Go ahead, Tokela.
All right. So can you see my screen?
We can see your screen. You're rather quiet, so if
Okay.
you can speak right into that microphone, that would be great.
Excellent. All right. Can you hear me now? Is that much clearer?
We can hear you. You're a little quiet, so as much
Okay.
as you can project and lean in, we would appreciate it.
All right. What about now, Shannon?
That is better. Thanks.
Excellent. Thank you. All right. Thank you so much, Shannon. Hi, everyone. My name is Tokela. I work here at Milwaukee Health Services. And just wanted to let everyone know that actually, in a few days, I'll be here at this clinic for 1 year. So I'm really excited about that. So just wanted to say welcome everyone. And I just want to share some experience from an sister's point of view. Some of the experience in which I will be sharing today will be from information that I've gotten from my colleagues. And then the other would just be some of my personal experience. Okay. And so with all the different policy changes, and Shannon, for whatever reason, I did a next and it's not going down. Apologize for that. I'm unable to go to the next slide there.
Is it not advancing, Tokela?
It's not advancing. Okay. You're sharing your screen. It says that, but then I cannot advance to the next screen here.
Tokela, what you can do too is right now you're currently sharing your screen. If you go up, you should be able to share the PowerPoint by itself. That might correct the issue.
Okay. You should share the PowerPoint.
So when you go to share, it should give you multiple options and it should say share your screen or share your PowerPoint software. And you'll want to select the PowerPoint software itself.
And I think it might say application, and then you have to choose the application, Tokela.
So DC application, start the Microsoft PowerPoint. Is that the?
Yes.
Okay. All right. Excellent. Thank you. All right. So, like I said, I'm coming from the point of view of when I got information as far as from my colleagues, and I will be sharing some personal information as far as my personal experience with consumers during this time. So we've gotten a lot of information as far as with the policy changes, what's normal policy and what's the COVID-19 policy. So I just want to share with everyone what that experience has looked like during this time. And so I first want to start out with some positive experience. And so when it comes to working with Milwaukee Enrollment Service agents, I just want to say that it has been a very positive experience as far as when it comes to waiting time. You know, it has not been, you know, an extremely long time as far as just waiting on the phone. I've just, our agency or our clinic has been very impressive about the willingness to just be there to assist consumers during this time. You know, with everything going on with all the different obstacles and policy changes and, you know, just individuals losing their jobs and or just reduced in income and no insurance at all. It has really been a good experience. I think part of the positive experience is just through all the webinars that we've gotten, the constant emails that we're receiving as far as updates is concerned, and also just sharing that information with the colleagues. So that experience to me has been very positive. And as an advocate, just helping consumers during this experience has been very rewarding. These individuals, you know, are individuals who, in normal circumstances, would not even apply for state insurance or wouldn't even qualify. But just in this whole case, just helping them from beginning to end has been a very rewarding experience. So we've seen an increase in an uptick as far as in our clinic, as far as increase in enrollment for Badger Care, Foodshare. Some of those individuals that have been affected was school teachers, individuals from Potawatomi Casino, just working professionals. So these individuals, you know, have once again has, you know, it has affected their income in some way or just their level of hours that they work. And so this can be a very uncertain, unknown uh, time for you to go through that and these very individuals who may never apply for this, you know, it's scary. It's like, what does that look like? You know, because for the most part, most individuals who are maybe accustomed to getting insurance through their employer, now they have to go through the state. It's like, wow, you know, now I need a handout. So we just want to be there to just assist consumers to say, I'm here for you. This is a basic need. Everyone needs insurance. It's only temporarily. So, you know, it's okay to be able to get assistance during this time. And so, how can we help? Is my thing here. So, one of the ways that we do assist individuals or consumers during this time is through Skype. So, and then another way in which we help during this time is face to face. Currently, right now, our clinic, we go in 2 days out of a week. Then we also assist individuals as a need to need basis, meaning that we assign someone or up for application, and for whatever reason, they don't either have a laptop or a computer at home or a smartphone in order for them to be able to submit their information. So we will assist them by just coming in and faxing off information or whatever may be needed when it comes to their application. And also face to face here. Okay. And so what do we do as far as when it comes to providing education to consumers? One of those ways is, you know, like I said, we see as far as where their income level is at the time of application. We provide, you know, under normal circumstances, when we talk about the policy changes, normal circumstances, you may not qualify for Badger Care Plus, but because of COVID-19, you do qualify because of the there's no verification of income that we can do at this time. Autumn had talked about a little bit earlier that, we will accept information just based on a consumer applying for benefits. And that has truly been an experience as a whole that I can truly say that when an application is processed and I go in and I usually always have the consumer with me on the phone just to, if there's any questions that Milwaukee Enrollment Services agents may have, they're on the phone, they're able to just get whatever they need on the phone. I mean, that whole experience, once again, they go on based on just what that the consumer tells them at the time. Usually the application is processed right there on the phone, and and consumer right away get their answer, be it food share, Badger Care Plus, the whole experience once again has just really been effortless. So we provide that education for consumers. We provide when it comes to my access mobile app, we give them guidance on how to download the application. And then we also let them know as far as the limited services at the COGS location here on 12th Street, that they can go there on Tuesdays and Thursdays between the hours of 11 and 1. If they need to, send in or fax off documentation, that they're there to provide assistance for them as well. So,
Tokela, we've got a
yeah,
couple questions that I think would be great to answer now, and then we
okay,
can go into this next session. And
okay,
anything you can do to increase your sound would be appreciated. We're still having folks
okay,
having somewhat of a hard time hearing. And I
okay,
myself can hear you, but it is a little muddled. So anything
okay,
you can do to up that volume would be great.
okay. All right, thank you.
So our first question is for when you are doing in-person appointments with folks at the clinic
Yes.
for enrollment, what precautions are you using?
Oh, well, we have the 6 foot feet rule that in my office, there is when I meet with a customer, that they're about 6 feet from me. We do the whole face mask. Anyone who comes into the clinic must wear a face mask along with us. By me working in the office, of course, I don't have to wear it while I'm in there, but as soon as I leave out of the office, I have to put the face mask on. So that's one of the things. We're constantly using hand sanitizers. So when they come in, hand sanitizers is used, and I use it as well as when I meet with a client and when they leave. So that's what we're doing as far as um, the whole um, spacing, for clients when they come in.
Great, thanks. And then
You're welcome.
there's another one related to this. And when you're helping folks to use the My Access app
Mhm.
in face-to-face appointments, how are you doing that? They specifically ask, are you touching their phone? I think under normal
Yeah,
circumstances,
right,
somebody might help them manipulate the phone. So they're just wondering,
exactly.
how are you approaching that?
Well, once again, the 6 feet rule is just, you have to just kind of, if they want to, here's what I see, from afar, you can kind of see on their phones, yeah, this is what you do, here's the app. So once again, we really do abide by that 6 foot rule. And so with that being said, they have to stay within that 6 feet rule. And I can kind of see their phones when they're face to face. And so I can say, yeah, this is where you go, this is where you go.
Okay, we'll continue on and then we'll take more questions and after this next
All right.
section. Sorry.
That's okay. Thank you, Shannon. So, as you may know, with anything, there's always roadblocks, right? So there's the positive, and then there may be some little hurdles that you may have to go through during this experience. So, one of the things I can say with backdated coverage, was a minor hurdle. It was not a I say something big, but just little. With anything, you always get the little trickles through the cracks where the little hiccups may happen. So with that being said, this actually is a real life story in which I experienced with backdated coverage. I did have a consumer who had came. Actually, I did the application over the phone, and she wanted backdated coverage for 3 of the months. And so, with that being said, I had asked her if she could, submit, verification of income of what her income was for the previous month. So she did submit those information, that documentation. I looked at it, and from what I can tell, she indeed did qualify for backdated coverage. That information was submitted to Milwaukee Enrollment Services. It took a little bit of a time. When I called back to confirm, what was going on with her backdated coverage, I had to call back, I would say a couple of times as far as when it comes to just not getting that answer. Some of the answers that I got was she didn't qualify, it's still pending. So nevertheless, I still pursued and kept following up. And, eventually she did get coverage for the months that truly she was covered for. But it was a bit of a hurdle, just kind of going back and forth. Once again, this is a consumer who, has reduced in hours, her income is less, and she's getting increased uh, medical costs. So can you imagine how she felt? Very frustrated. Like, I qualify for these benefits, but I'm not getting an answer, and my medical bills are steadily increasing. But the bottom line to that is that it was finally we finally got an answer, and she did get the backdated coverage that for those months that she applied for. So that was one of the hiccups or roadblocks that we experienced. But once again, it wasn't anything that was, I would say, a major problem, but just a couple of calls that we got from that. And the other scenario was I had a couple of individuals who had a termination letter that was sent to them, just saying at the end of this month that your coverage would end. And I called the Milwaukee Enrollment Services along with the consumer to figure out what happened. I know during this time of pandemic that no member should lose coverage. So if you can just kind of, please provide what happened in this scenario. But I don't quite remember exactly what the agent shared with me, but as a result of calling and just making sure, to see what was going on, the consumer, coverage did not end. So, there was no end in coverage. It continued on. I reassured the consumer, just to let him know that, I'm glad that you reached out to me, because he was, a little frustrated and frantic because he had some upcoming procedures that needed to be done, and he just wanted to make sure that his coverage was still good. So in this scenario, he was one of those individuals actually that income would have went over for the following month. So that's actually the reason why he received it. But once again, we know during this time of the public health emergency that no one would lose their coverage. So that was a positive outcome for that particular consumer. Oh, so now I guess we have a polling question. You want me to read that?
Great. I can read the question,
Okay.
and then Mike can put up the polling question. That would be great. I think there's actually two questions, and if they can both be posted at the same time, that would be great. So I'll read the scenario. So Sally Brown is applying for Badger Care Plus for the month of October, and her household size is 1. So it's just her. Her current monthly income is $1,200. Mrs. Brown would like backdated coverage for the months of July, August, and September. Her monthly income for July was $1,200. For August, it was $1,000. And for September, it was $900. So using everything you know, when can Sally's eligibility begin and when might it end? And Tokela, you can go, I think, to the next slide because we have some helpful tables there for folks to use. So there's a little case review, and we thought we'd supply you with some of the details needed to figure out this case. And we'll give you the full 2 minutes to answer these two questions.
And we do only have about 30 seconds left on that poll, so we will let that finish up, and then I will go ahead and post the results.
Great, thanks, Mike. And as you post the results, then Tokela, you can walk through the response.
Okay. Let me know when I should answer.
You can go ahead and do the answer now.
Oh, I think I went too far. Once again, I apologize. All right. So the answer is Sally's eligibility can begin in August and continue through the duration of the public health emergency, despite being over income in October. All right. And it looks like most of the people gave the answer B, August. All right. Anything else, Shannon?
No, that's great. Yeah, so it looks like most people knew the response there, and part of it is figuring out her particular income eligibility and when she's within the 100% of the FPL. So it took combining a few pieces of knowledge to get to that answer. And then the second one was a little bit of a trick question, given that the answer was other. It will continue for the duration of the public health emergency. But Tokela, we do have a few questions for you.
Okay.
So someone is wondering, what's the average time an assister spends in signing someone up for healthcare coverage? If you had to ballpark it.
When it comes to just the application itself, it could be between and half an hour to 40 to 45 to an hour. So it just all depends on family size. Sometimes family size makes a difference. So if you have more individuals in the family, of course, the application, could possibly take up to an hour and a half just because of the different questions that may come up and all the different on the application process. With all the just different layers to the questions that's asked in the application, it could take up to an hour, hour and a half. But normally within the hour, half an hour is when it's kind of the simple application where it's just one individual and it's not a whole lot. Maybe they're not working and it's just really just a kind of a straightforward question. So I would say give or take, it just depends on family size.
Great, thanks. And then we had another question about helping people with the My Access app on their phone.
Yes.
So once they have downloaded the app on their phone, what information is needed for them to register to access the app?
Okay. So usually what I do is after the application has been completed and that the consumer has created an account for them, I instructed them to say, you can go on My Access app. They're going to ask you if you're enrolled, and from there you'll say yes, or if you have a case. And usually, I guess at the time they really don't have a case number; it's just an application number. But it does allow them to go in to download whatever information that's needed, the social security card or birth certificate, so whatever that information is. So once they go in, they're just asked if they're enrolled. If they are, then they are able to upload whatever documentation is needed for the application.
Okay, great.
Mhm.
We've got now some Medicaid policy questions. So if we can bring Autumn back. Thank you so much for your
Oh,
presentation, Tokela.
thank
If we
you.
get another question for you, I'll be sure to call you out. We
Okay.
are at 10:16, and this session was scheduled to end at 10:15. We will go 4 more minutes to answer a few questions and end at 10:20. So if you can stay with us, great. If you can't, we understand. But we'll do just a couple questions here. So we have a question about Medicaid, so Badger Care Plus prenatal for women who are otherwise not eligible for Medicaid because of their immigration status. Can the 3-month backdate be requested?
It cannot. There are some programs that allow for a 3-month backdate and others that don't. And unfortunately, the Badger Care Plus prenatal is not category, and that has not changed during COVID.
Okay. We have another one that is, how is DHS handling the cases of consumers that are not able to get asset verifications due to businesses that have been closed because of COVID-19?
So that was one of the drivers for why we opted for the best available information policy. So asset verification is also under that category, that we will take what people report and won't pend cases for asset verification.
Okay. So those were quick, and I'm quickly scrolling through. I'm sure that there is a questions I've missed. There were a few particularly complex case-specific questions that we're not going to do today, just because that sort of requires a level of detail that we're just not going to get into. So we will follow up with the askers of those questions specifically. So thanks for sending in those questions. But sometimes things get too in the weeds to address with this large group. So either, we've got one more. So this will be our final question. So after Health and Human Services ends the public health emergency, when will the community engagement and time limit requirements for childless adults be implemented?
So I don't know. Those are things that we had not implemented yet. And so it's sort of a TBD on when they would be. Nothing was paused because of COVID. It was, we didn't change any policies around those things. So it's still TBD when those policies will be implemented.
Okay, great. Well, thank you so much. I'm gonna hand it back over to Allison at Covering Wisconsin. Thank you, Autumn. Thank you, Tokela, for a really great session. I know I learned a lot, and a lot of this information was highly desired by by the folks attending today's conference. So thanks.
Thank you. Thanks for your time today.
Allison, we can't hear you. I see you talking, but I don't hear you. Do you want to try again? Nope, we still don't hear you. So Allison, whatever you would like me to share with the group, if you just want to go ahead and put it in the chat. I believe everybody should just stay online, and the next session will begin at 10:45, right? Thumbs up. So we'll see you all back here. If you just want to mute your computers, step away and take a break. And we look forward to seeing everybody again in just a few minutes.